Did you know that this simple green vegetable sitting in your kitchen might be causing health issues without you even realizing it? Most people over 55 make at least one of these mistakes when eating chayote, and some of these errors could affect your medications or health conditions. Chayote, also known as vegetable pear or mirliton, is a nutritious green squash that has been enjoyed for centuries. This mild-flavored vegetable originally comes from Mexico and Central America, and it's packed with vitamins, minerals, and fiber that can benefit your health in many ways. However, like many good things in life, chayote can cause problems when not handled or consumed properly. Many people in our age group don't realize there are specific precautions we should take, especially if we're managing health conditions or taking regular medications that are common after age 50. Why do some people experience uncomfortable reactions after eating chayote? What mistakes are many of us making without realizing it? How can this nutritious vegetable actually interfere with certain medications? And what's the proper way to prepare chayote to avoid skin irritation that many people complain about? Stay with me until the end to discover all the answers to these important questions that could make a real difference in how you enjoy this healthy vegetable. Before we begin, please subscribe to our channel and turn on notifications so you never miss important health information like this. Let us know in the comments which part of the world you're watching from. Let me explain what makes chayote special and why it's worth understanding how to use it safely. Chayote belongs to the same family as cucumbers and melons, but it offers unique health benefits that are particularly valuable as we get older. This vegetable is remarkably low in calories, with just 25 calories per cup, yet it provides essential nutrients our bodies need. It contains vitamin C for immune support, folate for heart health, and potassium for blood pressure regulation. The fiber content helps with digestion, which becomes increasingly important as we age. Chayote also contains special compounds called flavonoids, particularly one called myricetin, which research suggests may help protect our hearts and support healthy blood sugar levels. Think of chayote as nature's multivitamin in vegetable form. However, these same beneficial compounds and nutrients can sometimes interact with medications or cause issues for people with certain health conditions. That's why understanding the proper way to consume chayote is so important, especially for those of us who are managing multiple health considerations as we get older. Mistake number 1: eating chayote when you have kidney problems or take certain medications. This is particularly important for people over 55, as kidney function naturally changes with age. Chayote contains high levels of potassium, with about 400 milligrams per cup. If you have kidney disease or reduced kidney function, your body may not be able to properly process this much potassium. When potassium builds up in your blood, it can cause a condition called hyperkalemia, which can affect your heart rhythm. Elevated potassium levels can lead to arrhythmias, which may cause symptoms like irregular heartbeats, palpitations, or even cardiac arrest in severe cases. Additionally, chayote contains natural compounds called oxalates. While these aren't harmful for most people, they can be problematic if you have a history of kidney stones or kidney disease. Oxalates can combine with calcium in your kidneys to form crystals, which may contribute to stone formation, leading to intense pain and further complications. If you take medications for high blood pressure, particularly ACE inhibitors or potassium-sparing diuretics, adding high potassium foods like chayote without medical guidance could cause your potassium levels to rise too high. This combination can be dangerous, as it may lead to life-threatening hyperkalemia. Always discuss high potassium foods with your doctor if you're managing kidney issues or taking heart medications. Never self-prescribe dietary changes, as your healthcare provider can give you the most accurate advice based on your specific health status. Mistake number 2: drinking large amounts of chayote juice without moderation. While chayote juice has become popular for its health benefits, consuming too much can lead to digestive discomfort. Many people think that if a little is good, more must be better. But this isn't true with chayote juice. The vegetable contains natural fibers and compounds that, in large amounts, can cause stomach upset, bloating, and diarrhea. This is especially important for people over 55, as our digestive systems often become more sensitive with age. The digestive system slows down with age, making it more difficult to handle high quantities of fiber or new foods that the body isn't accustomed to. The recommended amount is no more than 1 cup of chayote juice per day, and it's best consumed in the morning rather than on an empty stomach. Drinking large quantities of chayote juice, especially on an empty stomach, can irritate the stomach lining and lead to discomfort, including acid reflux or indigestion. If you're new to drinking chayote juice, start with half a cup and see how your body responds. Some people find that drinking chayote juice too quickly or in large amounts causes them to feel nauseous or experience intestinal gas. This is particularly true for those who are not accustomed to a high-fiber diet, as the sudden increase in fiber can overwhelm the digestive system. Remember, you can get many of the same benefits by eating the whole vegetable, which provides fiber and helps slow down absorption, making it gentler on your digestive system. Also, incorporating chayote into your meals as part of a balanced diet will give you more consistent benefits without the potential side effects associated with drinking juice in excess. Mistake number 3. Peeling and cutting chayote without proper hand protection. This mistake affects almost everyone who handles chayote for the first time, and it can be particularly bothersome for people with sensitive skin, which becomes more common as we age. Chayote contains a milky sap that's similar to latex, and this sap can cause your hands to feel sticky, dry, and irritated. Many people describe a burning or tingling sensation that can last for hours after handling the vegetable. The sap can also cause temporary numbness in your fingertips, making it difficult to handle other objects. This reaction happens because the sap contains natural compounds that can irritate human skin. For those with latex sensitivities, the reaction can be even more severe, leading to rash or swelling. To avoid this problem, always wear kitchen gloves when peeling or cutting chayote. Wearing gloves creates a barrier that helps prevent direct contact with the sap. If you don't have gloves, you can rub a small amount of cooking oil or salt on your hands before handling the vegetable, creating a protective barrier. This makes it easier to wash off the sap without irritation. Another helpful technique is to cut off the narrow end of the chayote first, then soak it in warm water for about 10 minutes before peeling. This helps reduce the amount of sap that comes out during preparation, making it easier to handle and reducing skin irritation. If you experience severe irritation, wash your hands immediately with soap and water and apply a soothing lotion like aloe vera. If the irritation persists, consult a doctor to rule out an allergic reaction. Mistake number 4. Eating chayote while taking blood-thinning medications. This is a crucial consideration for many people over 55, as blood-thinning medications like warfarin become more commonly prescribed as we age. Chayote contains vitamin K, which plays an important role in blood clotting. While this vitamin is essential for healthy bones and proper blood clotting, it can interfere with blood-thinning medications that work by blocking vitamin K's action. If you regularly eat chayote while taking warfarin or similar medications, the vitamin K content could potentially reduce the effectiveness of your medication. This could lead to an increased risk of blood clot formation, which may result in strokes, heart attacks, or other complications. Conversely, if you suddenly stop eating foods high in vitamin K, it may cause your blood to become too thin, increasing the risk of excessive bleeding. This doesn't mean you can never eat chayote, but it does mean you need to be consistent with your intake and keep your doctor informed. Sudden increases or decreases in vitamin K intake can cause your blood clotting levels to fluctuate, which could increase your risk of dangerous blood clots or excessive bleeding. If you're taking blood thinners, talk to your doctor about including chayote in your diet. They may want to monitor your blood clotting levels more closely or adjust your medication dosage to accommodate consistent chayote consumption. It's important to be aware of other foods that may also affect your blood-thinning medications, such as leafy greens, which are also high in vitamin K. Consistency is key in managing the balance between diet and medication for optimal health. Mistake number 5. Consuming chayote if you have a known allergy to related vegetables. While chayote allergies are relatively uncommon, they can be serious, especially for people who are allergic to other vegetables in the same family, such as cucumbers, melons, or squash. These vegetables share similar proteins, which can trigger allergic reactions in sensitive individuals. As we get older, some people develop new food sensitivities or allergies that they didn't have when they were younger. This is due to changes in the immune system, which may become more reactive to certain foods over time. Chayote allergy symptoms can range from mild oral irritation, such as tingling or itching in the mouth, to more serious reactions like difficulty swallowing, skin rashes, or breathing problems. Some individuals may also experience gastrointestinal discomfort, including nausea or vomiting. In rare cases, people can experience a severe allergic reaction called anaphylaxis, which requires immediate medical attention. Signs of a serious allergic reaction include swelling of the face, lips, or tongue, difficulty breathing, rapid heartbeat, and widespread skin reactions. If left untreated, anaphylaxis can be life-threatening, so it's crucial to act quickly by seeking emergency medical help. If you've never eaten chayote before and you have a history of food allergies, start with a very small amount and wait to see how your body responds. It's also wise to discuss potential allergies with your doctor before trying new foods. If you experience any unusual symptoms after eating chayote, stop consuming it and consult with your healthcare provider. Keep in mind that cooking chayote doesn't always eliminate allergens, so even cooked chayote can trigger reactions in sensitive individuals. If you are unsure whether chayote is safe for you, an allergist can perform tests to determine if you have an allergy to chayote or other related vegetables. Now that you understand the potential mistakes to avoid, let me share the safe way to prepare and enjoy chayote. The key to safely handling chayote starts with proper preparation. First, gather your supplies: kitchen gloves, a sharp knife, a cutting board, and a bowl of warm water. Put on your gloves before handling the chayote to protect your hands from the sticky sap. Rinse the chayote under cool running water and gently scrub the skin to remove any dirt or residue. Next, cut off about ½ inch from the narrow end of the chayote, as this is where most of the sap is concentrated. Place the chayote in a bowl of warm water and let it soak for 10 to 15 minutes. This soaking process helps reduce the amount of sap that will come out when you peel it. After soaking, you can safely peel the chayote using a vegetable peeler or a small knife. Work slowly and carefully, peeling away from your body. The seed in the center is edible and quite nutritious, so don't throw it away unless you prefer to remove it. Once peeled, you can cut the chayote into slices, cubes, or any shape you prefer for your recipe. Remember to wash your hands thoroughly with soap and water immediately after handling chayote, even if you wore gloves. If you do get chayote sap on your skin despite taking precautions, wash the area immediately with dish soap, which cuts through the sticky residue better than regular hand soap. When it comes to consumption guidelines, moderation is key, especially for people in our age group. A reasonable serving size is about 1 cup of cooked chayote, or ½ a cup if you're drinking chayote juice. This amount provides beneficial nutrients without overwhelming your system. If you're managing diabetes, start with smaller portions to see how chayote affects your blood sugar levels, as individual responses can vary. For people taking medications, consistency is important. If you decide to include chayote in your regular diet, try to eat similar amounts on a regular schedule rather than having large amounts occasionally. This helps prevent any potential interactions with your medications. If you have kidney concerns, limit your chayote intake to no more than ½ a cup twice per week, and always discuss this with your doctor first. For digestive comfort, avoid eating chayote on an empty stomach, and consider having it as part of a balanced meal that includes some protein and healthy fats. While chayote offers many health benefits, it's important to be aware of situations where extra caution is needed. If you have a history of kidney stones, particularly calcium oxalate stones, limit your chayote consumption and increase your water intake when you do eat it. People with severe heart conditions should consult their doctor before adding high potassium foods like chayote to their diet. If you're scheduled for surgery, stop eating chayote at least 2 weeks beforehand, as it may affect blood clotting. Pregnant women can generally enjoy chayote safely, but should avoid consuming large amounts of chayote juice. If you experience persistent digestive issues, skin reactions, or any unusual symptoms after eating chayote, discontinue use and speak with your healthcare provider. Thank you for taking the time to learn about chayote safety. This information can help you enjoy this nutritious vegetable while avoiding common mistakes that could affect your health. If you found this helpful, please give us a thumbs up and share this video with friends and family members who might benefit from this information. We'd love to hear about your experiences with chayote in the comments section. Have you tried this vegetable before? And did you know about these precautions? You'll notice we have 2 videos on the screen now, and I'm confident you'll enjoy continuing to watch more content like this. Take care of yourself, and remember that small changes in how we prepare and consume our food can make a big difference in our overall health and well-being.